It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day, everyone. I am so excited to have my distinguished guest that I have today, mainly because most people know a little bit of my history, and I have a doctor here that specializes in, number one, skincare and natural weight loss. But this is not, when we say natural, not a supplement, but I want to say that our topic today is how to have a flawless complexion and a flat belly in 45 minutes. And I know I have received several calls and people have said, 45 minutes, that's impossible. But it's possible. I've actually been with him and watched the beginning phases of the weight loss. And you see the difference within 45 minutes. And you don't need many treatments. But let's start first. We're going to start with the skincare. But first, before we start the skincare, I'm going to introduce my wonderful, distinguished guest. I am so thrilled that he has taken time out of his busy schedule to be here, to be a guest on NuWellness TV, Dr. Santiago.
Hi, Dr. Lee.
Thank you.
Hi, Dr. Lee.
How are you?
Thank you for having me here. I'm pretty good, thank you. Thank you. I'm really grateful for inviting me to your show. I'm really pleased to be here.
Yes, I'm just so pleased that you're here today, because if you know someone or yourself, please share this show. I want you to share it. If you know someone or yourself that's having skin problems, acne, teenagers, adult acne also, eczema, and this is my passion because I was scheduled to have my legs amputated from eczema when I was 7 years old. Mm-hmm. So skin is really one of my major passions as well. And then to meet someone who has something natural for skincare, was just a given.
Okay.
This has been part of my prayer. So I am so pleased that you're here. So there's so many skin conditions. You're going to be showing some, people.
Yes.
And the best way for you to know is the before and after. And Dr. Santiago has what he's going to show you, some before and after. So the possibility, it's endless possibilities that you can have flawless skin. If you look at people in Hollywood today, everybody has this glow.
Yes.
And everybody is looking younger. And now I know why. I've had one treatment for my skin. It was natural. Usually I have a pretty good complexion, but people have been giving me more compliments on my skin after just one treatment.
Okay, pretty good.
So it's something that we're doing at NuWellness Healthcare, but I'm going to turn it over now to Dr. Santiago. So tell people as to why you got started in this, please.
Okay, all right. My name is Santiago Esquives. I actually came here to the United States when I was pretty young. I came here to school as a foreign student.
Well, you look young now, so.
Well, we're talking about 10, 15 years ago when I started pre-med school here. Actually, I did my prerequisite for medicine here in the United States. I went to Loma Linda Medical School for pre-med. I got my bachelor's in science with a minor in respiratory care. Okay. So I'm licensed by the state of California as a respiratory practitioner. And then after that, 9/11 came. So I had to leave the country because I was a foreign student. So the process for immigration was really complex back then.
Yes.
So I had to leave the country and went back to my own country and did medicine.
Okay.
Then I came back to the United States because I wanted to do aesthetic medicine.
Yes.
But then I found the surprise that in the United States, it doesn't exist as a specialty in medicine. We only have plastic surgery, but we do not have aesthetic medicine as a specialty. So I went back again to Europe to do my master's in aesthetic medicine.
Wonderful.
So I finally got my master's in aesthetic medicine, and I've been practicing for the last almost 4 years.
Congratulations.
Thank you. On the way, I met a fabulous product that is being produced in Europe that came to my hands, and I started trying it myself. I liked it, and I started using it so many of the product that the owner of the company contacted me, and he wanted me to show him my own patient results.
Yes.
So I showed him to him, and then what he did is proposed me to train the other doctors around the world in what I was doing, getting such results.
My goodness.
So what I did, I started doing doctor's training all over the world. I went as far as Ukraine in the former Soviet Union countries.
Okay.
And I did this for about almost 2 years. But then
2 years?
I had to quit because my own practice was left alone during this time, and I just came back to my own practice.
Okay.
So in exchange for this sort of like a job that I did with him, he allowed me to introduce this brand to the United States because this market was still not open.
Okay.
I founded Cosmetica USA, which is a company that opened in 2016. And ever since then, I've been trying to introduce it to the market, this fabulous product. So far, we're doing really good. This is a very unique product because it's based on human enzymes.
Human enzymes, okay, like stem cell.
Right,
human.
right.
Oh, but
more or less, more or less the same. I think for people to understand what an enzyme is, our own body does all physiologic processes through enzymes, enzymatic processes. Those who have a few knowledge on medical background, they'll know that we function through enzymatic processes all day long.
Yes.
And the most familiar one to people is, I think, is lactose-free milk. I always give this example because lactose-free milk, I think we're all familiar with it.
Yes.
So what they really do is they do not take the lactose out of the milk. They add lactase into the milk. So by the time we drink the milk, when it heats up a little bit in our own stomach, the lactase activates and then can digest the lactose on the milk. But because it's really complex.
I think a lot of people thought just the opposite.
Yes.
A lot of people thought
they
that.
like take it away, but there is no way you can take out the lactose from the milk because it's a sugar component of the milk.
Yes.
So because it is so complex, they just say lactose-free milk for market purposes. But that's really what they do on lactose-free milk.
Okay.
So that's what it does. So basically, an enzyme is a molecule that is gonna build up something to convert one simple thing into a more complex thing,
right.
Or it's gonna break down something too as well. So it could go either way.
So the breakdown and the build up.
Yes,
yes.
Of course. That's what it does. So this gentleman who developed this line, he went to Harvard University. He has his PhD on biochemistry from Harvard University.
Okay.
And he spent 10 years on this project where he developed 4 human enzymes, genetically identical through genetic engineering. And he finally got those enzymes, and he put them to work to our favor, adding different vitamins and different natural ingredients to these enzymes. And then he developed this fabulous brand that he called Pivot Serum.
Yeah. You said it's natural. Is it plant-based or?
No, it's science-based, based on human enzymes production. So basically, it's natural from the scientific point of view. Is made genetically, but it's getting enzymes out of our own system to mimic the body natural functions, basically.
Okay.
So I'll give you an example. For instance, one of the enzymes is lipase.
Okay.
When we go on a diet, we restrict ourselves from calories. So what happens is our digestive system produces lipase, which is the enzyme that is going to break down the fat. Yes. So it travels through our bloodstream, goes to the fat deposits, breaks them down, and then produces energy. That's how we lose the weight.
Yes.
Well, now we have the lipase on a bottle that you can just hydrate, put it on top of the skin, let it penetrate into the skin, and direct it to the fat deposits to break it down, and that's how you lose volume to those
That's how you
handles.
lose the fat.
Yes.
And guess what? We're going to get into more. Would you like to have some people are paying hundreds and thousands of dollars for a butt lift? And well, we can do this through losing the fat around the upper part of the thigh, and it gives you the whole curvature that you would want to have there. But not that, just love handles, belly fat. Fat anywhere from the neck down, we'll be able to get rid of. But we're going to go into more of the facial too.
Oh yes. This line, he developed 2 lines, facial line and then body line. The face line has to do with different skin conditions that we have and we've been facing for such a long time. Very complex problems such as acne that has been for ever since humanity has been on Earth.
Yes.
And it's really complex because it's produced by a bacteria, so more or less it's an infection of the skin. It's really hard to reach because it's in a very upper layer of the skin, so anything taken from the inside out is very difficult to reach it because it's on the very top of the layers of the skin.
Yes.
From the outside, inside is even more harder because the skin is a barrier, so the skin does not allow anything to penetrate the body. But now we have here this a very smart enzyme, which is keratinase. It's an enzyme that he produced. So we have keratinase on top of our skin. So the outer layer of the skin is made of keratin. So keratinase breaks down keratin on the skin. It sort of like cracks, opens up the skin, and then allows all the ingredients to penetrate so it can reach the bacteria and then kill it.
Okay.
So that's how exactly it does. And then other thing is there is lipase in it. So lipase penetrates as well, gets to the oil glands, and then diminish the oil production because that's where the bacteria actually is hosted. And that's how you get relief from acne in a very amazing way. I have some very nice pictures that I could,
I can't wait to see them again.
Yes,
I was just amazed.
You'll show him how they get relief from acne, very severe cases of acne. And only after a few treatments, they get really relief or very, very amazing result from the acne or any other skin condition.
Right. And you can slow down a little bit because we have an hour.
Okay.
And I want people to hear and see everything.
Okay.
You know,
I'm always on the run, so
I know.
Really fast talker.
I know.
And I'm always but let me know because I can slow down a little bit and I can talk even slower.
Yeah, because I want people to digest every word.
Yes.
As you go through this journey, because we're going to use this as a teaching tool and to show other people what they can help people to do as well.
Okay.
So I have information for you if you're interested in maybe going into this business yourself. Now you don't have to be a physician.
Yes, exactly.
You don't have to be a physician or an esthetician.
Yes.
So we'll go over some of those things, the qualifications you have to have if you want to obtain and do this line of business. So you'll be giving me a call at the clinic at 310 419-4300. I was about to get my cell number.
Okay.
310
that happens.
419-4300. You can always call the clinic. So I just want to say that share this show because there's someone you know, if not yourself, that's going to need this product for one reason or another, one body type or another. So let's keep going.
Okay. Well, you mentioned about how people can get to this. In a few minutes, I'm gonna let you know how I thought about how to introduce it to the U.S. market in a very specific way that it has not been introduced in any other country because the U.S. is a very special market. But before I go that, let me just tell you that for the face line that I was talking about, there is 5 different conditions that we can at least improve with this face line.
Wonderful.
He developed 5 different products for the face as well.
Okay.
And one of this is for something very specific. For instance, there is one for acne. There is one for melasma. We know melasma, dark spots, is a very serious condition too that people faces every single day.
And everybody calls me with that. Yes.
And the thing is that it doesn't.
Let's show a picture of what that looked like. You know,
okay.
Because we're saying that, and people know dark spots on the skin or age spots, but. Do you have a picture of a person?
Yes, we do.
Okay, so we're gonna.
Should we put it on the screen or should we put it? How can we show it to the people?
He's gonna show it. You just put it. Yeah. I think
what I can do is just. Let me see. I can show it to him.
And then he's gonna. We want our audience to see exactly what we're speaking on right now because. You or someone else, and he's going to tell you too how many treatments it took to get there. So if you want to go in order of your PowerPoint, don't let me break it up for you. So we want everything to flow for you and have it in order.
Let me just make sure I get this. For some reason, my computer froze.
Okay, so why don't you take a look?
Okay.
Yeah, because
yes. Okay. I'm gonna. Okay.
But you got to turn back
yes,
this way quickly.
Okay. So that's a case of acne. That very first picture is only one treatment. We did this. We had a very serious acne condition, and this first picture is a guy that came to my office, and then we did for acne treatment. We did one treatment, and then after a week we got the result from this very specific case. The following acne case that you may see there's a younger guy. I met this guy that came to my office, and he was still a teenager. Back then, we're talking about 3 years ago. He was only 18, 19 years of age. He was very embarrassed because of the acne issue. He had all the way down to his neck. And I proposed him to go through the treatments. We did about 8-9 treatments because they were very serious case of acne.
Yes.
But then at the end, we improved that much. You can see on the picture. And up to this date, the guy is free of acne.
Oh my
because we did
goodness.
this on a continuous basis. After we did the very serious case, we go on a continuous basis for at least another half a year. So make sure the acne does not come back. But we do once every 2 months, 1 or 2 treatments, and then after that he's cured from the acne because he's getting older. And then finally we got rid of the acne.
Okay. Now it's just the same. I know he's a lighter complexion. Is it the same? It doesn't depend on the complexion at all?
No, it does. It doesn't have to do anything with the complexion. Anybody who the acne gets the same results.
Okay. What about the men from shaving and have the razor bumps?
Okay.
That are pretty bad.
Okay, that's different. That's a
I know that's a little different.
That's folliculitis. That's so different. Yes, it has nothing to do with acne. That's another condition. That has nothing to do with our product. It's not
your product.
Yes.
Okay.
Absolutely,
Wonderful.
Yes.
Just wanted to know because I've seen a lot of men.
Yes.
With,
I know.
Okay.
Yes.
Okay. So we're gonna go to the next case.
Okay. The next case. Let me just make sure. Okay, that's the same. Okay, it was the acne, but then if we move on, we'll go over to the melasma cases.
Okay.
As we go on.
Wonderful. So it's a female.
So it's a female. Yes, a female. For the melasma, we have people from young people to older people. Let's say more mature people with the same problems. Here we see on the first case a young lady. She came to my office. She's looking with a very dull skin and very kind of opaque. Port nourish skin, and the melasma product is made out of vitamin C. So vitamin C, nothing else but vitamin C, and then keratinase, which is the enzyme that is gonna help the vitamin C to penetrate the skin.
Right. So you can take a quick.
Okay. Yes, that's the case. That's her. Yes. So you can see her. She has this very dull skin and very pale look in the skin. After we do the treatments, only 2-3 treatments, she looks very glowing skin, very nice looking skin, very healthy skin, or healthier skin, I would say. And the dark spots we don't see much because she's on the front view, but it's on the side view. As a side view, we can see a lot of changes on the dark spots that she had. But overall, if people do not have those dark spots of melasma, with the vitamin C on the skin, it gives us this very nice glowing on the skin as well. So just forgetting this nice glowing that you were talking about, saying that Hollywood people has a lot of this, so this nice very glowing. This is what they've been doing lately.
I know, I could tell.
Vitamin C on their skin, and that's how they get this very nice glowing on the skin as well.
So it's a little procedure. So it's not just you buying a bottle of vitamin C and rubbing it on your face. It's not that easy.
No, it's not that easy, exactly.
But it's not hard neither, so it has to be done by a practitioner.
Yes, exactly.
Yes, but it's amazing. I know I left with this glow and my skin just was amazing.
Yes.
And still I've only had one treatment. And I noticed the next day all I need to do is put cold water on my face and it went back to where it was after the treatment.
Yes, exactly.
So I've had my experience.
Okay, that's I'm glad to hear that too.
Yes.
Sure.
Yes.
Okay. We go on the next case. The next case is a really serious case of melasma.
Okay.
You can see this is a very serious case of melasma.
She looks like a friend of mine, and her case does too.
Okay. So that's her. This lady came to my office too, and then she's on her 50s, early 50s, and she has this very serious melasma case. She's been using any possible thing you can imagine out there on the over the counter, and she was not being able to get rid of the melasma. We did a few treatments. Cases like this take us about anything from 8 to 10 treatments because this is a very serious case.
Yes.
But at the end, you can see the results. We got pretty much very nice results with.
Oh my
her
goodness!
case too.
I mean, she looks younger. Her face is full, and she looks younger, and it's beautiful.
This face line contains keratinase. Remember, keratinase regulates how much keratin we should have on the skin.
Yes.
That's why you see this very nice glowing on the skin, this very natural glowing, because of the keratin layer diminishes, and this thickness of the skin or this dryness of the skin goes away because the keratin layers diminish due to the keratinase that we put on the skin.
Oh my goodness, her skin is gorgeous. And as she decided, I mean, once you know you look better, you'll start improving your outer appearance as well.
Of course, yes.
And with your product, it's no like dietary changes or anything like that.
No.
Because this is topical.
Yes, this is topical, and they just keep on doing their normal daily activities without any changes. It goes on the skin, but it has to be applied by a professional. They do not do them themselves. They have to go to attend
you can come see me.
Okay, they'll come to see yes, and then they'll know how to do it. Yes.
Yes, most definitely. So that's wonderful. So what is our next case here?
Okay, let me see real quick. Okay, we move on because remember I talked about 5 different products. So the next one is made out of hyaluronic acid.
Okay.
I think people out there may be related to hyaluronic acid because they go to doctors to get fillers on the lips or fillers on the face.
Yes.
Some way or the other. So those fillers are made of hyaluronic acid. Hyaluronic acid is a protein that we have under our skin, and it gives us this appearance of youthfulness on the skin.
Yes.
As we age, this hyaluronic acid production tends to diminish as well, so we start getting this wrinkly skin or this saggy skin because of the loss of the hyaluronic acid production.
Right.
We have pure hyaluronic acid on these boxes, and then we hydrate it and then put it on the skin. Again, it penetrates the skin by the simple reason that we have keratinase as the main vehicle of delivery to our own skin with this brand. This is what makes different from the big difference from any other brands out there, because our brand has keratinase, which is the main key to open up the skin and allows, in this case, the hyaluronic acid to penetrate. If you go to any store, you can find thousands of creams and products made out of hyaluronic acid.
I see it all the time.
But the problem is that those cannot penetrate the skin because the skin is a barrier. Again, it's something that is not going to allow anything to penetrate the skin. Otherwise, we'll be dead because there is a lot of contamination, a lot of smoke, a lot of contaminants on the skin, on the air.
Go right into the body.
Yes, exactly. Yes. So that doesn't happen due to our skin.
And then your product, too, is not just applied on the skin with the hand or even the practitioner. It's done in it's a method.
Yes, it's a method. That's right. It's a method.
Because I had it done, so it's a method.
Yes.
So don't try to do this yourself at home and think you can go buy the over-the-counter stuff and do it at home.
No.
Don't do that.
Plus, they won't find it over the counter because it has to do through a certain way of buying it. We'll explain it later on, but it has to do by a professional as well.
Exactly. So my goodness, that's a big difference.
So we have this lady. She has this fine lines all over her neck, and then if you see a side view, the next picture is side view. I think is on by the neck area. You see this skin folds.
Right.
Once the skin gets hydrated, every molecule of hyaluronic acid has the ability to hold 200 molecules of water. So you can imagine, just by adding a few milligrams of hyaluronic acid on the skin, it hydrates the skin, so it holds a lot of humidity. So your skin tends to give you sort of like a mini facelift. That's why you see all the skin being lifted up.
Yes, that before and after is amazing. It almost looked like there was some Botox or something.
Yes, exactly. Like some fillers on the face and some fillers on the face, and then her skin got this hydration, and then she gets sort of like a small facelift due to the hydration of her skin.
And no facelift was done.
No. It's just the products.
And I wanted to just reiterate that because of the fact she looks so wonderful. Oh my goodness, these pictures are amazing.
Oh, thank you.
It almost looked like a different person.
Those are real patients of mine. All these people.
Yeah. Oh, I know. Because we met a while back.
Okay, sure. Yes.
Okay, so the next case.
The next case, he's a gentleman. Again. This is with hyaluronic acid. He's a gentleman. He came. Nowadays, we have a lot of customers, male customers. We'll say 60% of our, not 60, I mean, but the other way, 40% of our customers or patients are now gentlemen.
Okay.
So they come for face and they come for body as well nowadays. So that's pretty good. So
my goodness. Men and years ago, you didn't hear a man say, I'm going to go do this to my face. But now in this time, especially we live in Hollywood.
Yes, exactly.
And not just that, people are more concerned about their appearance. And, you want to look as good as you can, but you want to be as healthy as you can, too. Yes. And don't just think I'm going to apply something on the outside and leave the inside, and don't put in your body what's going to nourish the body as well. I'm going to say that because I'm a medical person into nutrition as well. So we have to make sure we put the right nutrition. But can you imagine nobody changed their diet or had to have surgery? And the before and after is just amazing. I love that picture. We need to enlarge that one so people can really get a close-up look at that picture, Tony, if you don't mind.
So
this really need to see that. Yes. That is amazing.
This is remember, this is hyaluronic acid, and it's meant to be or to improve the fine lines. Because as we age, we tend to develop these fine lines, but mainly it's because of the skin dehydration, because of the losing water on the skin, which is one of the aging theories, that we lose water, and that's how we start developing these wrinkles on the skin. So again, we hydrate that skin through the holding water through the hyaluronic acid, and then we improve any lines that we have on the face or the neck area. Because with this, every treatment of this is good to work from the neck all the way up to the forehead, so it covers the whole neck and the whole face.
Wow! And look at our next person too.
Okay, that's another lady again. That's for hyaluronic acid as well too. People comes for various reasons
Yes.
to see your business or because they want to improve somehow. So this lady's concern was her forehead by some particular reason. I explained her, by your jawline, this saggy skin that you had is sort of like got pulled back up again, and very nicely elasticity you have by all over your face, and this nice glow in your skin. But she focused only on her forehead. And she liked those forehead lines disappear, and she liked it because they went away. But that's the only part very funny, but it happens to people because they only focus sometimes on very specific part of their face because that's what they're bothering them actually. But it's an improvement all over the face actually, not only in one particular face.
Oh my goodness, her face looked gorgeous.
Yes,
it's
exactly.
absolutely beautiful. Okay,
yes.
So we'll move into the next case.
Okay, this is one of the other products. This is called Extreme Firmness. This one
Extreme
is
Firmness.
Firmness.
Yes.
That's right.
Okay.
Yes. This one contains the ingredients that it contains is vitamin C, hyaluronic acid, and it also contains one of the enzymes which is collagenase. So all those combines, again, it penetrates the skin and then it nourishes the skin in different ways. So this one does a few things like the other ones does. For instance, it sort of like improves the skin coloration. It improves the skin texture because it improves the fine lines. So this is for more mature people, let's say, for older people that wants to get their treatments as well. So this is the more complex or the more complete treatments of all those, the other ones that I presented. So for people that with a certain age has a few issues on the skin, not only fine lines, but they have problems with the coloration of the skin, they have dehydration of the skin, they have these various things that can be managed with this. The extreme firmness is called this in this case.
And this one here
so we have the first case. Yes, this is a lady that she loves to go on a sunbaths during the summertime. And as a consequence of that, the skin gets really wrinkly. There is no other way to say it. It's like when people smokes, the same result. We get this very damaged skin because of the smoking or people exposing themselves to the sun and a lot of exposure to the sunlight. So she had her neck with the wrinkly skin, and then we have the extreme firmness because this contains all of the other ingredients. And this is how much improvement we get after only 6-7 treatments that we did on her.
6 or 7 treatments
on her neck. Goodness. How much her neck improved, and you see by her jawline too as well how much she got this pull up, sort of like a mini facelift or lower facelift. You would
think there was some type of surgery involved or fillers.
Yes, exactly.
And this is all topical. Keep in mind, this is all topical.
Yes. But we are with at least 95% of penetration on the skin, which makes this brand really different than any other one.
Yes.
There is a membrane in medicine that we call Franz membrane to measure how much anything can penetrate the skin. Anything topical has to penetrate the skin. It has to be gone through this membrane, and that actually lets you know how much penetration it has on the skin. So this brand, all of this product has a 95% penetration on the skin, which is a very, very high penetration. So we have 25 milligrams of hyaluronic acid, at least 20 milligrams penetrate the skin, which is really high because on a filler, 1 cc of a filler is only 22 milligrams of hyaluronic acid. So it almost mimics the amount of 1 cc of fillers.
Yeah, for a filler. Oh, my goodness. And look at this next lady. Absolutely gorgeous.
Yeah, you can see there the extreme firmness. It gives you this it gives you sort of like a facelift because it hydrates the skin again. It improves the skin coloration and it improves the skin hydration. So you see this lady on the before picture, she has a lot of sort of like hanging skin on her face.
Oh, yes.
And if you see the after picture, she improved her face a lot.
No,
you can we equilibrate.
She looks almost 20 years younger, 15 years younger.
We treated her pores. She had a lot of open pores. She had a lot of this lines on her face, and then we improved her to the point we equilibrate her face very nicely. Her skin became very soft, and those open pores almost got completely closed by the after picture. On the after picture.
Oh my goodness, she looks absolutely gorgeous.
Yeah, she does.
And now our next.
Okay, this is another lady. This lady is on her 70s. She was actually my first patient that I treated because I asked her. She's a client of mine since I began actually practicing aesthetic medicine.
Okay.
And she came to my office and I asked her, can I try this on you? Because you're a perfect candidate because she's very disciplined as far as getting her treatments done on time.
Okay.
She accepted it, and then I started doing it. I did 6 treatments on her. She had these dark lines around her eyelids. She had these fine lines all over her forehead, the fit crow lines that tend to appear. Yes. So I did the treatments and then look at the after picture, how her skin color changed, improved a lot, in a clear color. And then those dark spots around her eyelids improved a lot, and those fine lines by the fit crow improved as well too.
Okay.
So this product that we're talking about is good for fine lines, for skin coloration, and for getting this skin hydration.
Okay. Now, for people of color or a person with darker skin, does it lighten the skin as well? The Radiant, the one for improving the skin coloration, is the Radiant. This is only made of vitamin C. This is the one that it needs to be used using the Fitzpatrick scale. With people who is a cosmetology or esthetician out there, they'll know what I'm talking about. The Fitzpatrick scale is the one we measure the skin coloration, and any number 4 and above cannot be used because it tends to change the color on the skin. Okay,
Fitzpatrick scale below 4 can be used on the complete line. Fitzpatrick scale above 4 cannot be used. Only the Radiant, which is the one specifically for melasma.
Okay, so people are looking at me and people know me. So where would I be on the scale?
You'd be on the scale. You'd be a 3, more or less a 3 on the Fitzpatrick scale.
Okay, so I would be.
So you would be a candidate still for the Radiant, which is the one for make the skin in a more even tone.
Yeah.
But for the rest, you're fine, and everybody is fine.
Actually, that's the treatment I did have.
Yes.
Because I had just had my eyebrows arched.
Oh, I see.
And after arching eyebrows, and then I had a mustache, and after they removed the mustache, after they did all that, I was so discolorated. I had such a discoloration and all these hyper and hypo pigmentations in my face before light and dark. Before I had my treatment, and after my treatment, I was totally even.
Okay, good. Okay.
So I would tell people, once you have, if your eyebrows arch and you have extra hair on your face, I went too long. And I have a daughter that she would definitely say, Mom, go and get that hair off.
Okay.
But I noticed that after that was done, because I went like 2 days after.
Oh, I see.
And so it just evened my complexion very nicely.
Okay, that's pretty good. Yeah. It's only a few people with very dark skin, and only one of the products cannot be used, like I said, because it tends to, let's say, gives more clear skin color on the skin.
Yeah, my skin was even and clear. Yeah, and I think it still is now, even from that one treatment.
Yeah, you can tell it's very calibrated. Yes.
Yeah, I just put a lot of ice water and cold water on my face.
Oh, I see. Okay, that's really good. Sure.
Yeah.
So should we talk about how people can get hands on the product actually?
Well, I think with the hands-on, they're going to call me. We're going to talk about that. So they'll call me at 310. You can do 292-2408.
Okay.
Also, 310-292-2408 or 310-419-4300.
Okay.
And then they can call me, and then we'll get everything start going.
Okay.
But I want you to let people know the ones who can actually obtain doing this. You don't have to be an esthetician now, right?
No, this is how it works.
Yes.
When I first thought about the U.S. market, I saw the U.S. market, and I met a few estheticians, and I met this fabulous lady that is working with me, that she's been doing in the esthetician business for 35 years.
My.
So I asked her, and then she said, the industry is not doing so well since the last at least 10 years.
Yes.
So I thought about how this product could make an impact in the beauty industry, all over the beauty industry, because there is a lot of beauty schools out there.
Yes.
And
when you say beauty schools, we want to make it clear that we're speaking of cosmetologists.
Yes, exactly.
Cosmetologists and barbers.
And barbers, cosmetologists, and estheticians. That's what I meant by beauty schools. They go to get their certification and the training on those schools.
Okay.
So I thought about how could this be introduced into the United States, giving them a tool so they can work and they can make their earning and they can do it professionally.
Yes.
So what I did is different in other countries. In other countries, they just bring the product to the market and they just sell it restricted to doctors and to only, let's say, high professionals or more restricted the way they work with this brand.
Exactly.
I came to the United States and I put it to the lower level, let's say, to the level of estheticians, cosmetologists, and barbers. They have to get a training, though, to get certified and then being able to practice with the brand, because they cannot just buy it. They need to get certified and then get training for a while, and then they get very familiar with the brand, get mastered the brand, and then now are really prepared to solve those conditions that the clients are going to bring to their places. And now we have it available to the estheticians, cosmetologists, and barbers. From there up to nurses and physicians who want to use the line at their medical spa practices as well.
And then we'll get into the weight loss component, and that's open for massage therapists as well.
That's exactly. Yeah. The second line would be the body line, which is for getting rid of fat deposit. The purpose of this line, he developed this line for getting rid of fat deposits, improving cellulite appearance, and getting rid of fluid retention. After people gone through aesthetic surgeries like liposuctions and those kind of surgeries, they tend to retain a lot of fluid. And if the fluid gets retained in their body for a long time, let's say a couple months or a few weeks, they tend to develop a condition that we call fibrosis. So fibrosis is the hardening of the tissues. And when they develop this, they do not get this softness and this improvement or this much result from the surgery that they were expecting through this hardening of the tissues. So for the body line, he introduced 3 different enzymes. He developed the lipase, which is the enzyme in charge of breaking down fat.
Yes.
He developed collagenase, which is another enzyme to get rid of collagen fibers, which are the fibers that surround the cellulite issue. That's why you see all these dips and bulges on the skin due to the collagen fibers.
I've seen that
around the fat cells, and which are really, really hard, made of collagen, and we break it down through collagenase.
Yes.
To make it easier, to simplify it, he called the products on the market, he called the one made of lipase slim. The one made of collagenase, he called it smooth, because that's what it does. It makes the skin smoother. And then he called the fluid retention drain. That's
very good.
Under those names, we find it really on the market or through this certification program.
And drain is really important too. You want to drain that away.
Yes. Everything was based on the cellulite the pathophysiology of cellulite. This is how it was funded, because remember, this is science based.
Yes, it is.
This is a brand or a line of products that came out of scientific research. Not only because somebody just found it anywhere, they had to develop it.
Yes.
Based on human physiology and how the body works and functions.
Yes.
So he developed this. That's how he developed these enzymes.
Okay.
So if we go over the, that's the body line. Those are the slim, smooth, and slim. Can we go on the second slide, please?
Okay.
Just keep on going, please. Yeah, right there, please. That's there. It seems to be really complex, but it's not.
Yeah.
It explains how cellulite is formed. This picture came out of in a Japanese magazine back in 2014, I believe, and it was an article saying how cellulite develops in humans.
Yes.
So cellulite has 3 stages. Some books talked about 4 stages, but all the books or most of the books talk about 3 stages. So at the beginning of cellulite, and it's very important because people is gonna understand after I say these words. We have the first stage where just anybody, or let's say we have somebody still in their 20s, and that's where when the fluids that we have on our veins or arteries circulating in our blood start leaking out of the vessels. For some reason that we don't know, they start leaking out of the vessels, these fluids, along with some sugars. These sugars starts accumulating around the fat cells, and the fat cells start getting engorged, start getting enlarged, and as they get bigger and they grow, collagen fibers start surrounding them. So collagen fibers start surrounding them, and then the collagen fibers get so big that they start strangling the own fat cells, and that's when you see the actual formation of cellulite.
Yes.
And we have these 3 various specific products to each one of those work on different stages. For instance, to prevent cellulite, and it's been proven by scientific studies and research,
Right.
that if you use the drain before or when the liquid starts leaking out of the circulation, you use the drain to drain this liquid excess. You prevent the further advancement of cellulite.
Okay.
So that's when you use the first one, which is in the first stage. That stage, we don't know. We don't even feel it because it happens. You only see a little bit of swelling in the area.
Okay.
A little bit of swelling in the legs, swelling of the some areas in the body, and that's all you can even.
Or
something
you
can even
see that the skin is not smooth.
There you go.
Yeah,
Yes,
you don't,
yes,
it isn't
yes,
smooth.
exactly. So you use the drain, and just for sort of a preventive thing, you can use the drain every single night. There is a home care line too.
Okay.
Out of this, only for the body lines, there is a home care. Which
But this is
the
after
drain.
they have seen the practitioner.
Yes, of course. Yes.
Okay. I just want to stress that.
Yes,
so people
once
don't.
they have seen the professional they're being treated by, and then they refer them home with this home care product, so they can use it every night to prevent the further advancement of cellulite,
Okay.
or to prevent the development in the first place.
Okay.
So
Wonderful.
And then we have collagenase on the other hand. When they say we're on a second stage, when the fat cells start getting a little bit bigger, we have there the slim, which is made of lipase to break down those fat cells or diminish them, and then we improve the appearance of cellulite.
And this happens how fast? I know we're going to get to some wonderful pictures because
well, it happens. Cellulite development, it can happen in about 6 months, as fast as 6 months.
But I saw the results of
okay.
Yeah.
The results are different. Once you use the line, the results you can get it same right away after the very first treatment. You can see results.
And we have on the screen there the treatment and how it's done. It's very wonderful. I have the machine myself.
This line has to be done with the aid of a machine.
Yes.
We call it cavitation machine. There is a machine that is basically working on ultrasonic waves, and you add on the skin this line because it's oil based, so you just put it on the skin instead of a gel, and then use the machine to aid it penetrate the skin. Again, because it penetrates really fast, then you can start seeing the fat breaking down. It lasts about 45 minutes.
I could not believe it because I went through training.
Yes.
And I had my dear friend there, so she had the treatment done, and we actually measured her because you have to do your measurements and everything as well, but not even after. We didn't even have to measure her to see the difference because it was the smoothest.
Yes.
The cellulite was gone and the smoothness of her skin was nice. So I'm telling you, it all happened so fast. And she had on pants too, just like this picture here. She had on pants, and when she was able to fasten her pants after her treatment.
Okay.
And had room. There was a lot of room left.
Yes, I see.
Just with one treatment in 45 minutes.
Exactly.
45 minutes. It was amazing.
Yes, because remember, when people has this only fatty tissue, let's say, or like in this case, this young girl, she's on her 20s. She had a baby, and after she delivered the baby, 6 months has passed, and she got this fat around her belly. Yeah. And she went to the gym. She did diet. She did everything. Couldn't get rid of this belly fat.
I hear that from women all the time.
Yes,
I exercise, but I can't get rid of this fat.
That's very common. That's very common. Really hard to get rid of those last 5-6 pounds. It's really difficult to get rid of. So we used the slim on her, and after only about 6-8 treatments that she did, once a week, every week, the treatment, she improved that much. As you can see on the picture there, she improved that much after only 6 to 8 treatments that she did.
6 to 8 treatments.
Yes, exactly.
My goodness. But you'll see the results the very first treatment.
Yes, exactly. And the reason why, again, is because the enzymes penetrate really, really fast into the skin due to this high ability to penetrate the skin, and they start working as we physiologically do when we lose the weight, but in a faster and more efficient way because it goes straight to the fat deposits.
Straight to the fat. So I would tell people, stay with your diet, stay away from all those foods, make sure the cholesterol levels.
It's very important.
But I think people have more of a incentive when they can look in the mirror and say, oh, you know what, I'm looking so much better. And they'll stay with the diet even better.
Exactly.
So if you see the picture there, you see the lady's upper thigh. So if you had a lot of fat there, which she doesn't really have a whole lot, and a lot of people do, once you start to remove that, then you have a butt lift.
Yes, exactly.
Or maybe we should call it something else. But anyway, you get
but it's sort of like a butt lift, yes, exactly.
Yeah, that's how they're selling the whole program.
Yes,
and people
because
doing
their body gets more in this very more effective, more beautiful contouring. Due to
the thighs.
Yes, exactly. Thighs, the love handles, the waist, because the fat deposits went away or improved. This case is as a case of a lady in her 50s. She came because she wants to get more this body contour definition. And we worked on her for about 6-8 treatments as well. One treatment every week. And this is how much we improved her. This is how she was pleased, because here everybody's different. So the main concern on her was that she did not have any butt definition, she called it.
Okay.
And then with the treatment we did on her, she got this
definition.
I
could see in the picture she didn't have any definition at all.
Yes, and then she got this definition. She was so pleased that she was pleased with the results, and she didn't want to go further with more treatments.
Okay.
So that's her on a back view, and then we have side view of herself too, so you can see both pictures.
Okay.
Back view and then side view.
A front view. Okay.
Yes.
Okay.
And then we have the next case is another lady that again, she had this fat deposit. She had been through a liposuction actually. That's why you see this very like this is uneven skin or uneven tone on her skin.
Right.
And she developed fibrosis after the liposuction, and then after a few months she gained the weight again. She gained a few pounds again, and this is
after liposuction.
Yes.
Yeah. Okay.
Now you have this two issues. You have this uneven skin. This is very fibrotic skin with a lot of fibrous hard tissue beneath the skin.
Right.
And then you have this fat deposit. Now you have two issues. The first place she had only one issue, which was only fat. But then at the end of after the surgery, she had this double issue that we took care of. And the first, you see the picture, we only work with the slim to get rid of the fat. But you can see both the pictures. She has very uneven skin.
Okay.
Due to the fact that we did not work with the smooth, we only work with the slim, so get rid of the fat. And at that point, when we improved her, let's say her abdomen fat because it got diminished, she was a candidate, or she's a candidate ready for the smooth to even out the skin and then give it this very nice smooth appearance.
Wow.
So that she's only beginning that stage right now on the second with
So let's
smooth.
talk about the men.
Okay, the men. Okay, this is very funny because guys out there, there's a lot of guys out there that keeps on working out, and they work out every single day. They go to the gym, and they don't seem to improve at all. They just keep on having this love handles, this belly fat, and they just work hard, and they promise to go on a very healthy diet.
Right.
Nevertheless, they don't lose the weight. Well, we have the case of this guy. He was doing exactly the same thing. He would go to the gym for a couple of years and not able to get rid of this belly fat. Or even though he was dieting really good, he was exercising every day, almost every day. And then he came to my office. We did the treatments on him as well. And you can see his abdomen got really very nice definition after we did treatments on him too. It took us a couple of months. That's usually how it takes, about a couple of months, because it takes from anything from 6 to 8 treatments.
Right.
We take into account that it's done every week. Well, it takes about a couple of months to get him from before and then after picture to get him to that point.
Okay.
And again, this fat is lost through a very physiological way. So what I always suggest to people is get rid of sugars. Just make themselves sure that they don't ingest sugars after they do the treatments, after they gone through the treatments. For let's say the esthetician, the cosmetologist do the treatment, then they need to be a sugar-free diet for at least 48 hours, a couple of days, to make sure that the fat that has been melted or digested by the enzyme is gonna be used as energy.
Okay.
So that's what I always suggest.
So that's a big difference in this man here. I mean, he looks like he has a totally new shaped stomach.
Yes,
Let me just ask, because we're down to probably a couple more minutes left.
Okay.
How is it, how can you work with a person, say, that's 300 pounds?
Yes.
So it doesn't matter that they only need like maybe 10 or 15 pounds. What is the max amount? It doesn't matter of the weight at all then.
Here, the weight has to do with this. Like you said, you have a person with 300 pounds, let's say. Well, they need to first go to their physician, so they can put them on a very specific diet. And once they're on a diet already by a physician, because they need to lose a lot of weight, they need to lose let's say at least 80 pounds. Somebody who needs to lose 80 pounds. We suggest go to your primary doctor, to primary physician, to just give you this specific diet, to make sure he's gonna be watching you once a month at least. And then we are gonna be playing this role where we're gonna prevent the skin from hanging, because we know as they lose the weight, the skin tends to hang because of the volume they lose with this much weight.
Because that's what we do at NuWellness Healthcare. Actually, my assistant, one of my staff, she has her master's in nutrition.
Mm-hmm.
So that's what we do there.
I see.
Is we put people on full programs.
Okay.
That's why I keep bringing up the nutrition component, because that's my background as well. They get them on we put them on a full nutrition program. Now we have this component of yours.
Exactly.
This absolutely, because everything is monitored. And the BIA is monitored too, because you talk about hydration.
Yes.
So I'm looking at the BIA, which measuring the internal, external fluid in the body to see if they're dehydrated, along with the fat as well, to see if they're losing fat weight. So you see a significant loss of fat weight when you do a BIA testing, which is really important.
Here, like you said, either the nutritionist or the doctor can prescribe a diet for these people, and as they lose the weight, if they don't do something, their skin is gonna be hanging.
Yeah, I've seen that
with a lot of problems at the end. So if they start their treatments along with when they start the diet and as they lose the weight, we sort of like hold the skin in place and then make the skin even tighter by this line.
How wonderful!
And we have some pictures. I don't know if it's gonna be on this slide. Can you just go?
Okay.
Okay.
Okay. I don't. He's
no,
looking
it's
for them.
okay. No. As I remember, it's a different slide. But we have very severe case, and
I saw one when I went through my training.
That one.
Yeah,
that one.
I remember that.
That's the most severe case that I've encountered.
The lady's leg was very. She was obese.
And
you do have it.
Okay. There you go. Yeah. So the abdomen. The abdomen. Can you just the abdomen? The next one, please.
Okay.
Yeah, that one. Okay. This lady lost 80 pounds. This is an example of what happened to her.
80.
She lost 80 pounds. And then she went to see a plastic surgeon, and then the plastic surgeon did a liposuction for the last 4 or 5 pounds that she had on the abdomen. What happens? She ended up developing fibrosis on her abdomen. And
so that's what you saw by the time she came to you.
When she came to my office, she was looking like this.
Okay.
With her abdomen looking just like that. It was what we call frozen abdomen. Where it is hard as wood. You cannot even move the skin because it's so hard that she developed under her skin. A second liposuction. After one, this abdomen improved a lot.
We were going to you who are practicing massage therapy, Barbara. The show.
Yes.
So we can all have glowing, nice skin and look good, and and have the best quality of life after we're going through this journey. The best quality of life, but the best skin, because we're living longer, but we're living sicker.
Exactly.
We're living longer, but we're living sicker.
Sadly, it's happening.
Yes. Yeah. So we don't want that to happen when you know people like the Dr. Santiago, who is my guest here today, and myself. You want to live with the best quality of life and look as beautiful as you can. Healthy on the inside, healthy on the outside. Very important. So I want to thank you again for being a guest. I want to thank everyone today for tuning in. And as I end my show, what do I always say? Repeat after me. I am so grateful that I am a magnet for miracles. And I want to thank you again for being here. You were my magnet for miracles.
Thank you, Dr. Lee, for having me here.
You were definitely my magnet for miracles. Thank you.
Thank you.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.